Hi everyone, welcome to Engear. My name is Ramya Subramani and today we are going to see the importance of cultural sensitivity. Imagine you are a patient already feeling vulnerable and you are trying to explain your symptoms to a healthcare professional. Now add to that the challenge of a language barrier or a cultural difference that make your experience and belief seems completely foreign. That's the reality for many patients. And it's why cultural sensitivity is absolutely crucial in healthcare. Culture based areas like cultural differences, these can manifest in many ways. For instance, in some cultures, direct eye contact is considered disrespectful, while in others, it is a sign of attentiveness. A doctor who isn't aware of this might misinterpret a patient's behavior as disinterest or dishonesty. Similarly, pain, perception, and expression vary widely. In some cultures, stoicism is valued, while in others, open expression of pain is expected. A healthcare provider might underestimate a patient's suffering if they are not aware of these cultural nuances. Take the example of a patient from a collectivist culture where family plays a huge role in decision making. A doctor might need to include multiple family members in discussions, even if the patient is an adult, to ensure informed consent and adherence to treatment. In other scenario, a patient from a traditional culture might rely on herbal remedies or alternate medicines. Dismissing these practices without understanding them can create mistrust and hinder effective treatment. Instead, a culturally sensitive approach would involve inquiring about these practices, understanding their potential benefits and risks, and integrating them where appropriate. Now, let's address these language barriers. These are more than just a matter of translating words. They involve understanding cultural context and ensuring accurate communication. Imagine a patient trying to explain their symptoms in a language they are not fluent. They might use metaphors and indirect language that gets lost in translation. A simple headache might be described as a heavy feeling and a disturbance in the head, requiring a trained interpreter to accurately convey the meaning. Providing professional interpreters is essential. Relying on family members, especially children, can compromise patient privacy and accuracy. Medical jargon needs to be explained in a simple, culturally appropriate terms. Visual aids like diagrams or pictures can also be incredibly helpful, especially when explaining complex procedures or conditions. Conclusively, cultural sensitivity in healthcare is about building trust, fostering understanding, and providing equitable care. It's about recognizing that every patient is an individual with unique needs and experiences. By embracing cultural diversity and addressing language barriers, we can create a healthcare system that's truly serving everyone. Thank you and stay tuned with Engear for more videos.